Lingual artery arises from external carotid artery, opposite tip of greater cornua, divided by three parts by hyoglossus. First is in carotid triangle, clear a characteristic upward loop permits free movement of the hyoid. Second is deep to hyoglossus along upper border of hyoid, superior to middle constrictor of pharynx, superficial to middle constrictor. Third part, deep lingual artery or arteria profunda linguae is upwards along anterior border of hyoglossus, horizontally forwards and under surface of tongue. As fourth part, in vertical course between genioglossus medially and below inferior to laterally to inferior longitudinal muscle of tongue. Lateral to inferior longitudinal muscle of tongue. Horizontal part is accompanied by lingual nerve. Lingual artery, horizontal part accompanied by lingual nerve. Skin, scalp, 5 layers, skin, superficial fascia, deep fascia, loose areolar tissue, pericranium. Skin is thick, hairy, outermost, either into epicranial aponeurosis through dense superficial fascia, large number of sebaceous gland, and richly supplied by blood vessels. Superficial fascia is the second layer, more fibrous and dense at center than periphery, binds skin to adjacent aponeurosis, and medium for passage of vessels and nerves to skin. Deep fascia, epicranial aponeurosis or gallia aponeurotica. Third layer, freely movable on pericranium along with overlying adjacent skin and fascia. Occipitofrontalis muscle, it has two bellies both inserted into the deep fascia or epicranial aponeurosis. Anteriorly, it has insertion of frontalis, posteriorly occipitalis, attached to external occipital protuberance and highest nuchal line between occipital bellies. On each side, attachment is to superior temporal line and sends down a thin expansion which passes over the temporal fascia attached to zygomatic arch. Loose areolar tissue is the fourth layer, composed of loose areolar tissue, anteriorly extends into eyelids. Fourth layer, anteriorly into eyelids, posteriorly to highest and superior nuchal lines, and on each side on superficial temporal line. Superior temporal line. Pericranium is the fifth layer, which is loosely attached to bone surface but firmly attached to adherent sutures, where sutural ligaments bind pericranium to endocranium. Blood supplies from both carotid arteries, internal and external. The two systems anastomose over the temple. In front, it is supplied before backwards by supratrochlear, supraorbital, and superficial temporal arteries. Supratrochlear and supraorbital are branches of ophthalmic artery, which is in turn of internal carotid, and superficial temporal external carotid. Behind auricle by post-auricular and occipital. Post-auricular and occipital both are external carotid artery branches. Lymphatic drainage, anterior part of scalp by parotid or preauricular, and posterior by occipitomastoid or post-auricular. Mastoid and occipital or post-auricular lymph nodes. Nerve supply, 10 nerves on each side, total 4 sensory, 1 motor, 5 in front, 5 from the back. Front in sensory we have ZT, AT, supratrochlear, supraorbital, and temporal branch of facial nerve, and from back we have from dorsal ramus and cervical plexus. From cervical plexus we have lesser occipital C3, posterior division of greater auricular C2, C3, greater occipital and third occipital, greater occipital C2, third occipital C3, both from dorsal ramus. Motor, from front temporal branch of facial nerve, and from back post-auricular branch of facial nerve. Maxillary nerve is a sensory nerve originating in anterior border of trigeminal ganglion. Maxillary nerve, anterior border of trigeminal ganglion, and leaves cranial cavity through rotundum. Maxillary leaves cranial cavity through rotundum. Maxillary nerve enters pterygopalatine fossa. Maxillary nerve enters pterygopalatine fossa, enters the orbit via inferior orbital fissure and accompanied by infraorbital artery. Maxillary nerve into orbit by inferior orbital fissure accompanied by intraorbital artery. Part of nerve in front of orbit is called continuation of nerve in floor of orbit is called infraorbital nerve. Maxillary nerve as floor of orbit as infraorbital. In floor of orbit, it passes within infraorbital canal, then infraorbital foramen, and then face. First canal, foramen and face. In maxillary artery, we had groove, canal, foramen, and face. Terminates by dividing into palpebral branches: inferior palpebral, lateral nasal, and superior labial. On face, we have three: inferior palpebral, lateral nasal, and superior labial. Then within cranial cavity, we have meningeal branches to dura mater of middle cranial fossa. in cranial cavity, meningeal branches to dura mater of middle cranial fossa. Within pterygopalatine fossa, ganglionic branches to pterygopalatine ganglion, zygomatic nerve, ZT, ZF, PSA. In pterygopalatine fossa, ZT, zygomatic, PSA, and ganglionic branches to pterygopalatine ganglion. Within fluoroforbate, MSA, ASA. Fluoroforbate, MSA, ASA, and within the face, superior labial, inferior palpebral, superior labial, and lateral nasal. In superior dental plexus, PSA, MSA, ASA, they enter maxilla and supply teeth of upper jaw and maxillary air sinus. Teeth of upper jaw and maxillary air sinus. Supplying teeth and maxillary air sinus, teeth of upper jaw and maxillary air sinus. Ganglionic branches bring sensation from orbit, palate, nose, and pharynx. Orbit, palate, nose, and pharynx. Ganglionic branches and receive secretomotor fibers through nerve to pterygoid. Secretomotor fibers. Ganglionic branches receive secretomotor fibers through pterygoid canal, supply lacrimal gland. In ganglionic branches in pterygopalatine fossa, maxillary nerve. ZF, skin over malar region, and zygomatic from zygomatic arch foramina. ZT enters scalp, supplies skin over temporal region and anterior quadrant of scalp. Skin over temporal region, anterior quadrant of scalp carries parasympathetic fibers. Ganglionic branches were receiving secretomotor fibers from nerve to pterygoid. ZT receives parasympathetic to lacrimal nerve to supply lacrimal gland. PSA. PSA is for molars. PSA enters maxilla via opening on its posterior wall. Maxilla via opening on its posterior wall supplies mucous membrane of maxillary air sinus. Joins superior dental plexus via plexus supplies molar in upper jaw and related gums of maxilla. MSA. MSA is for roof of maxillary sinus. MSA is for roof of maxillary sinus. From within orbital canal, its branches supply premolar. MSA, roof of maxillary sinus and premolar, sometimes join superior dental plexus. ASA is for anterior part of maxillary sinus. Branch of infraorbital part of maxillary nerve passes downwards into anterior part of maxillary sinus, divides into dental and nasal. Dental forms superior dental plexus by joining PSA and MSA through plexus. ASA supplies incisors and canines of upper jaw. ASA, incisor and canine of upper jaw, and nasal branch lower half or lateral wall of nose. Then palpebral branch, skin of lower eyelid and conjunctiva. Skin of lower eyelid, conjunctiva, nasal branch, skin on lateral side of external nose, and superior labial is skin and mucous membrane of lip and cheek. Skin and mucous membrane of lip and cheek. Applied anatomy, trigeminal neuroglia pain along course of all branches of trigeminal nerve, including maxillary. During cavernous sinus thrombosis, this nerve may be compressed by blood clot. During cavernous sinus thrombosis, maxillary nerve may be compressed by blood clot.